now, right? So this is not exactly, you can say, the recall of the July 2025 pediatrics, but basically the analysis of the paper also. Now what is happening is, many of the students, they are thinking that I made this mistake. Because this is what we are taking. You might feel this is simple one-liner question, I marked it wrong, right? It is not like this when they ask you in the main exam. You're definitely under the stress there. And at that time, everybody can make typically the simple mistakes. So that can happen with anyone, that the mistakes anyone can make, particularly in the exams, right? So don't consider if you're yourself to be that this is basically the recall, this is the not the exact choices what are there. This is happening with the students. Need not to worry at all regarding this. Second thing, what you should know, why the recall becomes important. Now they're asking the FMG exams, the NEET PG based questions. So NEET PG, after 1 year, 6 months, you will be on the other side also. You will be preparing for the NEET PG. You will also be interested what questions came in the what questions came particularly in the FMG exam. Sorry. So that might be they ask the same questions in the NEET PG also. So this is something which is, that's why you are concerned there, right? So if you consider this time, what were the questions? Basically the same topics. Neonatology had the question, respiratory system had 3 questions, milestone was a single question, congenital heart disease was a single question, right? In the CNS there were 2 questions basically. Nutritional disorders again had the 2 questions. What I could get was, right? So don't worry about the result or what basically is going to happen. Recall helps many NEET PG students also. Recalls help your junior students also who are preparing for next year FMG. So they also want to know what exactly the questions were there. So this is more of an analysis kind of a thing. The first question, if I go particularly, the first question, if I go here, what exactly the question says here. There is a 12-year-old child under evaluation for short stature. The upper segment, lower segment is 1:1. Bone age of the child is 10 years. There is no facial dysmorphology and testicular size is small. Out of the following, the likely diagnosis is. So this child is under evaluation for the short stature, and the particularly bone age is less than chronological age. Bone age is less than chronological age, right? There is no facial dysmorphology. Testicular size, 12-year child, the puberty will not be started. In a male child, delayed puberty, you say when? We say delayed puberty at the age of, but if there is no secondary sexual character, by the age of 14 years. Right? So when you are saying bone age is less than chronological age, it can be familial short stature, and idiopathic is the familial or genetic. And for some students, they said instead of this, there was achondroplasia which was given in the choice, right? So if it is achondroplasia, the BA can be less than CA, but if it is familial or idiopathic, that is the same. No facial dysmorphology, rules out idiopathic short stature, rules out growth hormone deficiency. In both, sorry, it rules out achondroplasia and it rules out growth hormone deficiency, because in both of them there is facial dysmorphology, right? And upper segment lower segment ratio, that is 1:1, that is proportionate for the age. So basically this can be constitutional delay in growth and puberty. So in the MCQs, if we just follow particularly what pattern, the exclusion pattern, you can definitely go to the choices. You can definitely go to the choices particularly, right? So what should be the right answer, that you come to know at that time particularly. Right. Next question. If you want to, some student want to say something. Dr. DBK said pneumonia, repeat. Yes, pneumonia is the very important question for you people. The genetics this time was unexpectedly very high. Child is having history of developmental delay. This upward slant of the palpebral fissure. So upward slant basically becomes is the Mongolian slant, hypotonia, single transverse palmar crease, flat face. Is a straightforward question, right? This all are the points in favor of the Down syndrome. Down syndrome. In the Patau syndrome, if you see in the hand, there is polydactyly. Polydactyly. Remember, P for Patau, P for polydactyly. In the Edwards syndrome, there is overlapping of digits. There is overlapping of digits and there is hypertonicity. Overlapping of digits and there is hypertonicity. Clear? So these are certain points. Simian crease likha tha clearly. Yes, very good. Simian crease was there, particularly clear cut. It was a clear cut Down syndrome. Very good answer, right? Simple question. This is a teenage boy, has a tall stature, gynecomastia, small testes, right? We have made it a one-liner. I know definitely there will be no one-liner when you must have attempted this question. At that time, it must be something different, right? So a tall boy, tall stature, gynecomastia, small testes. So directly the answer goes in favor of the Klinefelter syndrome. Klinefelter syndrome, that is 47XXY. Not only there is tall stature, what is important here, lower segment is more than upper segment. There is atrophy of testis. There is atrophy of the testis which is given here, and due to the atrophy of testis, there is decreased testosterone level. And if there is decreased testosterone level, that means reversal of the estrogen-testosterone ratio. There is reversal of the testosterone-estrogen ratio, and due to that reversal, there can be gynecomastia. Right. Thank you, Dr. Liberty. You are saying just 3 or 4 questions were confusive. Baki sab sahi tha. That's good to hear. So here the simple answer is 47XXY. 47XXY. Then again, out of the following genetic syndrome caused by deletion of short arm of chromosome 5. That is 5p deletion, and that is a feature of Cri-du-Chat syndrome. Basically, Down syndrome and the Cri-du-Chat syndrome, they both have certain features which are same. In both of them, there is hypotonia. In both of them, there is microcephaly. In both of them, there is flat faces. In both of them, there is low set ears. In both of them, there is VSD. In both of them, there is single transverse palmar crease. That is the simian crease. Right? So simian crease can also be seen in the Down syndrome, can also be seen in the Cri-du-Chat syndrome. What is the only difference? Yes, difference on this palpebral conjunctiva. Here you get is the Mongolian slant. Mongolian slant basically means is the upward slant of palpebral fissure, and here it is the anti-Mongolian slant. So next time they cannot write anti-Mongolian, they can write downward slant of palpebral fissure, right? And you start thinking downward is downs. No, in basically there is upward slant of the palpebral fissure is there. Now this question I do not know exactly what is asked or not asked, but some students have told me that this was the question which was one of the question. Most common congenital heart disease in the Turner syndrome. Although I am again saying it will be not a single liner question. They must have given something else. And the most common particularly in the Turner syndrome is the bicuspid aortic valve disease. Bicuspid aortic valve disease. This is particularly the most common. Coarctation of aorta is the second most common, right? No, second is the coarctation of aorta, and third can be the aortic stenosis. Clear? So it was a straightforward question. Agar aisa tha, so if you see here, genetics weightage has suddenly become 4 questions, and apart from this, 1 question of pedigree, that was adopted child, a bracket you got that, right? So I am teaching here those points which I basically cover in class in the pediatrics. So this was particular, if it was a question, I think these questions was quite good and scoring questions. Then going on to the questions of neonatology. A child has increased conjugated bilirubin Might be they have given the direct bilirubin, direct reacting bilirubin, because direct reacting bilirubin is conjugated bilirubin only. Clay colored stool. If there is clay colored stool, that means there is no stercobilinogen. No stercobilinogen. There is dark colored urine. Right? Very good, Dr. Devaki. Your डॉक्टर वाला लॉजिकल गैस हुआ ऑप्शन से. वेरी गुड. डार्क कलर्ड यूरिन. Dark colored urine is because of increase in conjugated bilirubin. That is something that conjugated bilirubin is what? Water soluble. So that is not because of urobilinogen. This is increased in conjugated bilirubin. Now if you see Gilbert, Gilbert may increase in unconjugated bilirubin. Kriegler-Nasser, increase in unconjugated bilirubin. Physiological, increase in unconjugated bilirubin. So all three are ruled out. All three are ruled out, right? If this were exactly the choices given. So we go for the right answer here. Extrahepatic biliary atresia. EHBA. Extrahepatic biliary atresia. And again, because of the recall I got from some students, there was also question investigation of choice for EHBA. I do not know exactly if that was the question, but this is a simple question which is there. Next. Now this was totally an unexpected thing. We never expected such thing to ask in the FMGE exam. Child is born to a mother. Biliary atresia can be asymptomatic. Yes, biliary atresia is mostly asymptomatic. Child feeds well. Only you get is the clay colored stool and dark colored urine. No other symptoms can be there, right? That is mostly asymptomatic you can get in the child is. Child is born to a mother with history of diabetes mellitus. Blood sugar is 25, right? And there are no symptoms present. So according to the students, it was 35. 35, right? Less than 35 it was there. So I changed to less than 35. Next step in the management is. The next step in the management is. So if you see here, the next step in the management. Now when we talk is the management of hypoglycemia, you should remember first we check whether it is asymptomatic or whether it is symptomatic. If it is symptomatic, then you require to give a bolus dose of 10% dextrose 2 ml per kg. Bolus dose of 10% dextrose 2 ml per kg. If it is asymptomatic, less than 20 or 20 to less than 45. In 20 to less than 45, you start with the oral feeds. And if it is less than 20, we start is the IV glucose infusion. Right? So if we go here, IV glucose infusion, no, because it is 20 to 45. Right? Recheck blood glucose, no, we will not check. We will not check the blood glucose here, and this is start oral feeds and we should observe after 30 minutes. No, we can't give here 25% dextrose, right? We cannot give here 25% dextrose. Understood? We cannot give. This question I am again saying you. This normally we teach in the NEET PG, but we don't teach in the FMGE. Well, personally, me I don't teach. This was a totally unexpected question for me also, because hypoglycemia, this is a simple protocol. In the neonate, the management is there. Clear? Next one. Neonate is born by normal vaginal delivery at peripheral health center. Out of the following, which is not to be done immediately after delivery. That is there, right? Again, it's a repeated question of NEET PG exam. Although students said particularly the language was, delivery was conducted by a A&M worker. It was conducted by the A&M worker, right? So what out of this, what wrong she had done? Cleaning both eyes, yes, this is good. Placing the baby on mother's chest, yes, that is good, because placing the babies on the mother's chest particularly, that results in more transfer of blood. That is one thing that decreases the chances of hypothermia. Second thing, start breastfeeding, yes, that is there. Immediately bathing the baby, no. This is not basically not to be done. राइट. सम वर सेइंग इट वाज बेथिंग द बेबी विद कोल्ड वाटर. कोल्ड तो वैसे भी यूज नहीं करेंगे न्यू बॉर्न में. इट वाज जस्ट अ मोर ऑफ अ IQ टाइप ऑफ अ क्वेश्चन. यस, अगर प्रज्ञा ऐसा था क्वेश्चन में कि ब्रेस्ट फीडिंग देंगे और 20 मिनट के बाद चेक करेंगे, तो दैट इज द राइट आंसर. We will, because if it is asymptomatic 20 to less than 45, we need to give is the breast feeds. You can see we need to give is the oral feeds here. ठीक है. Next, 3-month-old child difficulty in breathing being diagnosed as pneumonia, most likely, right? 3 month के ऊपर pneumonia you are saying, that means the answer has to be the respiratory syncytial virus. The answer has to be particularly respiratory syncytial virus, right? Because the most common cause, although don't think they must have written the word pneumonia, in this age group the viral pneumonias are more common. That is one thing. RSV is the most common cause. RSV is the most common cause. देखो, विदिन 1 आवर नहीं था या आफ्टर 20 मिनट्स था, उससे फर्क ही नहीं पड़ता. फर्क ये पड़ता है कि आपको ऑरल फीड्स देना था. दैट इज इंपॉर्टेंट, राइट? वी नीड टू डू, बिकॉज वो जो होता है ना कि कब मेजर करना, वो अलग हो सकता है, बट यू शुड रिमेंबर द पॉइंट इज दैट व्हाट हैज टू बी डन, दैट इज द सेम. दैट इज टू द सेम हियर. सो रेस्पिरेटरी सिंसिटियल वायरस इज द मोस्ट कॉमन कॉज ऑफ ब्रोंकियोलाइटिस ऑल्सो in the children, and bronchiolitis can be seen between 1 to 6 months of age. सर ये नहीं था, ये माइक्रो वाला था. ओके, रेदर देन निमोनिया एंड स्पाइक का क्वेश्चन था. हेड एंड नेक स्पाइक विद निमोनिया इन चिल्ड्रन. एच एंड नेक स्पाइक माइट बी. देखो, व्हाट आई एम सेड यू, दिस टोटली अ रिकॉल बेस्ड थिंग, और इसमें बहुत सारी गलतियाँ कि इस बार ऐसा नहीं हुआ पर्टिकुलरली कि ऐसे क्वेश्चंस मतलब रिकॉल में ना मिले. बहुत डिफ़िकल्टी हमें भी हुई है, बट इफ़ दिस वाज अ क्वेश्चन ओके, अदरवाइज तो आई विल रिमूव फ्रॉम द नेक्स्ट वी विल डू. सर फीड अगर 1 आवर के बाद करें तो नो 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 फीड 1 आवर के बाद. नो 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 नो. हाइपोग्लाइसीमिया इन अ न्यूनेट इफ परसिस्टेंट कैन लीड टू ऑसिपिटल लोब एपिलेप्सी. This can lead to particularly occipital lobe epilepsy. हाइपोग्लाइसेमिया 1 आवर के बाद तो फीड करना ही नहीं है, राइट? बिल्कुल ही नहीं. दिस इज टोटली रॉन्ग देयर. नेक्स्ट वन, 4-month child comes with history of difficulty in breathing, respiratory rate 58, chest indrawing, nasal flaring, not feeding well. This basically sums up everything, राइट? देखो, इन द अपर रेस्पिरेटरी ट्रैक्ट इन्फेक्शन चेस्ट इंड्रॉइंग का मतलब नहीं है. इन द अस्थमा वीजिंग शुड बी देयर. सो आइदर इट इज निमोनिया, आइदर इट इज सीवियर निमोनिया. नाउ वी हैव गॉट अ IMNCI classification, and IMNCI classification is for 2 to 59 months of age. 2 to 59 months of age. ऑप्शन वही था सर, वो बेबी में कौन सा स्टेप नहीं करना है. मतलब प्रज्ञा किस क्वेश्चन में, ये यू आर टॉकिंग ऑफ हाइपोग्लाइसीमिया की कौन सा स्टेप नहीं करना है. अगर इसमें था तो IV ग्लूकोज इन्फ्यूजन नहीं करना था. फिर IV ग्लूकोज इन्फ्यूजन के 2 चॉइसेस नहीं होंगे, राइट? इसमें तो हमने नॉट टू बी डन ही लिखा है, right? 2 to 59 months. Respiratory rate, if it is more than 50 per minute, or chest indrawing present, or both present, is pneumonia. लेकिन उसने क्या ऐड कर दिया साथ में? Not feeding well. And the moment you add not feeding well, this changes to severe pneumonia. This changes to the severe pneumonia. आपने कराया वो ठीक है, ओके. 2 ND वाले क्वेश्चन में, 2 ND वाले, चलो. चाइल्ड प्रेजेंट्स विद रिकरेंट साइनोसाइटिस, and particularly the child presents with recurrent sinusitis, recurrent chest infection,
Genetic analysis, there is mutation in single CFTR gene. Out of the following, gold standard to confirm the diagnosis is. 9th क्वेश्चन में सर आई क्लीनिंग फीडिंग आफ्टर 1 आवर था, विद इन 1 आवर नहीं था। देखो, अगर आप ये भी कहते हैं कि फीडिंग आफ्टर 1 आवर था, तो अगर बेथिंग था ना इमीडिएटली, वो तो आंसर नहीं होगा, रिमेंबर दिस। और मुझे नहीं लगता आफ्टर दिया होगा, मुझे लगता विद इन ही देना चाहिए, बट स्टिल इफ यू से आई एग्री, बट इमीडिएटली बेथिंग द बेबी तो बिल्कुल भी आंसर नहीं है, दैट इज नॉट बिल्कुल भी द आंसर। नॉर्मली बेथिंग ऑफ द बेबी इज डन आफ्टर 24 hours of birth, after 24 hours of birth, right? Now according to the latest Nelson, what it is being said, single CFTR gene present is positive screening test. We are not saying confirmatory, we are saying is the positive screening test. और अगर single CFTR gene है, this is followed by the sweat chloride test. Sweat chloride test. This sweat chloride test particularly is going to confirm the diagnosis. This sweat chloride test is going to confirm the diagnosis. तो आई होप सबका आंसर सही जाना चाहिए, इसमें तो कोई गलत नहीं है। 9-month-old child, history of dropping of head, brief spasm of neck and tongue, EG hips arrhythmic pattern. Straight forward question है. This question is of the infantile spasm. Now the point is, these spasms are here repetitive. This history of dropping of it, right? Why this point has been added? If you particularly see, there is neurodevelopmental regression. The milestones which the child has acquired, those milestones regress. जो milestones which the child has acquired, milestones regress. तो पहले might be neck control रहा होगा, अब neck control नहीं है. So what will be seen particularly, there is dropping of the head. That is the point. And the spasms are increased tone for less than 2 seconds. And on EEG, what we basically get is the hips arrhythmic pattern. On EEG, what we get is the hips arrhythmic pattern. So there is particularly dropping of the head, brief spasm है, EEG में hips arrhythmic pattern है. The treatment of choice here is ACTH. Right? या तो आई होप 11-12 नंबर ये तो सबके सही रहे होंगे, क्यों प्रज्ञा, मोहम्मद इमरान एंड डॉक्टर डिबेके, आई होप सो, इसमें तो कोई दिक्कत ही नहीं रही होगी। 5-year-old child has difficulty in breathing and history of becoming repeatedly blue. There is presence of digital clubbing and chest x-rays as shown, right? So if you particularly see in the chest x-ray, there is upturned apex. There is upturned apex, and this upturned apex is basically a sign of the tetralogy of fellow. Straight forward है, हर हमारे नोट्स में DFX में we show this X-ray, right? Other choices, one somebody said me was the Epstein's anomaly, and one choice was the tricuspid atresia. एक Epstein's anomaly है और एक tricuspid atresia, right? Good everyone, I think ये भी सबका सही रहा होगा. Child is able to smile and transfer objects from one hand to another. If the child is able to transfer objects from one hand to another, the age of the child is 7 months. 7 months. Out of the following, which other milestone will be present? Running normally child में आता है 18 months पे, response to the name 7 months पे, creeping 10 months पे, mature Pincer grasp 12 months पे, right? So if you particularly see here, 7 months में और कौन सा milestone होगा child में? Child responds to the name, that is particularly at the age of 7 months is there. Child has migratory polyarthritis. Diagnosis of acute traumatic fever is made. Best management is, according to the IAP protocol, if there is arthritis alone, we are just giving the child aspirin for the treatment. Aspirin. So if a child has migratory polyarthritis, we are suggesting acute rheumatic fever, no carditis. So what is sufficient? Only aspirin is sufficient. So aspirin, corticosteroids, benzathine plus penicillin, and one choice we can say aspirin plus corticosteroids. ये क्वेश्चन रियली में थे भी एग्जाम में या नहीं थे? People are not responding now. Were this particularly there the questions, or the questions were not there? अगर if you feel like any question was not there, any question में ये choice नहीं था, please do let me know. Definitely let me know. 9-month-old child has no BCG scar. Resist your BCG vaccination to the child at birth. Next step is, देखिए, first you should remember if there is BCG scar present, right? If what you should understand, if there is particularly BCG scar present, this does not indicates protection. BCG scar indicates inflammation. BCG scar अगर present है तो इसका मतलब ये नहीं कि child has adequate protection. This indicates inflammation. It is absent in 10% of person, right? डॉक्टर दिवेके ने कहा रोमैटिक फीवर था, प्रज्ञा ने कहा नहीं दिखा सर. ओके, 10% of person who has particularly received BCG, there is no BCG scar. There is no BCG scar, right? So even if there is no BCG scar, the BCG is not to be repeated. So only what you say is reassurance. Reassurance. Even if the Montox is negative, you don't give BCG. Remember. So only the thing has to be is the reassurance. इसमें था mother has telling BCG लगवाया था but scar नहीं है. Yes. Remember, in 10% of person who has received BCG, there is no BCG scar. So even if there is no BCG scar, nothing has to be done because scar का मतलब adequate protection नहीं है. Scar indicates there was inflammation at the time of the vaccination. Right. A straightforward question in VHL, von Hippel-Lindau syndrome. There is a genetic change involving the chromosome number 3. There is a genetic change which is involving the chromosome number 3 is there. Right, Neurocutaneous syndromes we all cover in the CNS part. So straightforward question. ये question 17 वाला बताइएगा था या नहीं था. In a child there is delay in growth, diarrhea, dermatitis. These are explained due to deficiency of the zinc. Right, newborn में इसमें mother is come, no scar seen to mother था, no प्रज्ञा. Sorry, child में नहीं था वो. Okay, zinc is a component of zinc finger protein which is required for the growth and differentiation. Good. I think फिर भी questions जो है ना, right? ये तो चलो बाद में होगा. One somebody told me there was a question on Wilms tumor. I could not get. If you remember, please you can share with me on my Telegram group, right? So please, if you get, was there a question of Wilms tumor? Question 8 was not at all. चलो इसको हम हटा देंगे आगे से. Question 18 was not there. No zinc question. We'll remove this question. If somebody remember, was there a question of Wilms tumor? Definitely there was an image based question of Jenu Welcome where the answer was vitamin D deficiency, right? But this question has already been covered in the orthopedics, but although we cover also, right? So we say this was particularly the question, right? Wilms tumor ka, if somebody can remember the question and do share to me. What was the question of the Wilms tumor? If you remember the question and you can share with me. Whatever was the question and whatever was the answers, now right now don't worry about anything. But what we say, the point I got from this paper, FMG paper toughness is slightly increasing. they are going more towards the NEET PG type of questions, more of the clinical questions, and they are no longer the straightforward questions. विल्म्स ट्यूमर क्वेश्चन था, जेनो वेलकम अडल्ट था, वन स्टिक के साथ इट्स स्केलेटल फ्लोरोसिस, ओके दैट्स गुड। अगर हमने फिर उसको इंक्लूड ही नहीं किया क्वेश्चन को। विल्म्स ट्यूमर का सर पैथोलॉजिकल डिस्क्रीट वाज देयर, पैथोलॉजिकल डिस्क्रीट ओके। अगर पैथोलॉजी का था तो वो भी हमारा क्वेश्चन नहीं बनता है, राइट। देन पर्टिकुलरली एनी क्वेश्चन ऑन नियोनेटल सीजर, if they've asked you regarding what is the first drug of choice for neonatal seizure, was there any question on neonatal seizure? First drug of choice in neonatal seizure something? So Wilms tumor is what particularly, what pediatric age भी था 5 साल के अंदर, okay. Other options were not matching with that age. They asked the tumor within. So they asked particularly the tumor. And Dr. Debeke, can you tell what were the other options? What were the other options in that question? If you remember anyone, any question on the Apgar score, on stunting, wasting, protein energy malnutrition, were there? 5 cell plus Wilms tumor co pathology was mentioned. This was the question, okay. Pediatric age, okay. If somebody can tell me any more question on Apgar score, was there a question on stunting, wasting, was there a question? Apgar was not there, okay, good. Apgar question was not there. Infantile spasm, we have already discussed the question. ACTH particularly we have discussed that question already. This was the infantile spasm. So overall no stunting, no wasting, okay. There was no question on stunting or wasting. And surprisingly they always ask you severe acute malnutrition, that all also not in the question. So this is what all questions I could judge. Hand, foot, mouth disease I have not discussed because we are not teaching that thing. That must have been covered by the microbiology people, right? So till then the result comes, all the very best. Do join us because this is a journey. Lots of syndromes. Tell me please what other syndromes were there, because we have said already a question was on the Turners, on the Klinefelters, on Downs, on Credusha. 4 syndromes we have said. Mohammad Imran, can you remember any more questions particularly? साथ साथ चलना है अभी तो, नीट पीजी की तो एक सीट निकालनी है हमें. हैंड फुट माउथ डिसोसिस टोदर सोर्सेस कवर्ड है, तो इसलिए मैंने उसको कवर भी नहीं किया. क्वेश्चन आई हैव नॉट टेकन. Any other question you feel particularly was there? No question on intrauterine infection, congenital toxoplasma, rubella, cytomegalo, herpes. कोई क्वेश्चन नहीं, क्योंकि बहुत स्ट्रेंज सा पेपर है. कुछ टॉपिक तो बहुत ज़्यादा है और कुछ टॉपिक बिल्कुल भी नहीं है. Done. So okay then, with this I take leave with lots of wishes to you all for your result. Let the result comes and we are going to celebrate it together, right? Thank you all. Thank you so much for joining.